Okay, we'll briefly introduce Joachim. Joachim de Eugenio is an environmental engineer who began his career at the German Federal Environmental Agency. But then, 26 years ago, he joined the European Commission, working mainly in the DG Environment and later in the Secretariat General. Since 2020, he has been policy advisor for zero pollution at DG Environment, where he coordinates the Zero Pollution Action Plan and contributes to many Green Deal initiatives and more recently to related to water resilience and chemicals policy. Today, Joachim will provide further insights on EU policy initiatives related to environment and health. So, Joachim, the floor is yours.
Yeah, thank you very much, and good afternoon, everybody. As you can imagine, I would love to be with you in Barcelona, but unfortunately this time it was not possible. So I'm happy that I can at least give you a little bit of an update from our side, because your cluster kickoff meeting couldn't come at a better time for us, because we really rely on your work to support and feed the policy work that we're doing, as Rita has already explained. Rita, of course, is there in Barcelona, also Gerardo, who speaks after me, and a couple of other colleagues are following it. So we're really keen also to learn after the workshop what your plans are and how we can factor in your results as soon as they emerge into our policy work. Now, I assume I can share my slides from here, so I will do that. And I hope that works for you. So
yeah. Yes, we can see it.
Excellent. So I wanted to just give you an overview of what is basically in work at the moment. Starting, of course, that we know, and Rita has also explained, is that pollution as such is very closely intertwined with the other planetary crises, and that again is linked to health very strongly. And we are really encouraged to see so much research going on at this interface, because I think in this political climate that we're in, I think the health dimension of environment and climate policy is one that speaks across the political divide sometimes better than other topics. I also think what, coming from DG Environment, what I always want to underline, climate effects are often exacerbating the environment effects. And so all the work that is going on climate and health, we very much appreciate, because it builds very much on work on pollution, on water, and other aspects. So see this a little bit as our attempt to really join forces here in Brussels between the different policy departments. And in order to give you a little bit perspective what's happening now, I have to start in the past, where in 2019, as you know, the European Green Deal was launched, and as a result of that, pollution was a very prominent topic. And we have developed the Zero Pollution Action Plan and adopted quite a number of initiatives. But before going to these initiatives, we also set out a long-term trajectory for what we would like to achieve in analogy to the climate neutrality by 2050. And here we basically made it very clear that pollution levels, whether in air, water, or soil, should be at levels that should not be considered harmful for health and for the natural ecosystems. And I think that's really our trajectory going forward in the long term. And of course, we have to do that step by step, which is why we also identified a number of quantitative targets for 2030. To help us going in that direction, I think with the European Green Deal, there were close to 100 pieces of laws that have been proposed, and most of them have been agreed. And most relevant for pollution, you see here a selection of them, is certainly to mention the Ambient Air Quality Directive, the work on industrial emissions. We have also worked on urban wastewater, drinking water, and the day before yesterday, Tuesday evening, there was an agreement on the updated list of water pollutants under water policy. There is going to be a new soil monitoring law, which is going to be published very soon, hopefully. So again, the legal process has not been finalized. And we also have done a lot in the area of waste management. The Eco Design Directive, just to mention a few, when it comes to also clean and circular products. I will not have the time, obviously, to go into all in these areas, but I think what is important for me was to underline to you that a lot of things have changed in terms of the legal framework. And what our president then pointed out when starting this new mandate in her second term in the end of last year was that not only making it very clear that we must stay on course to achieve these goals, but now the focus shifts to implementation. So it's more away from the policy and also legal discussions of a legal text to really make all these various aspects happen on the ground. And implementation only happens if we identify, on one hand, the problem very clearly and very precisely, so that we target our efforts, and if we then have solutions that are applied effectively. And I think here your research can make an enormous contribution. What is interesting always when you listen to our president, I don't know whether you followed the State of the Union speech that she gave, I think now 2 weeks ago. She pointed out again that she is a doctor by training, a GP by training. And so her heart is very close to the health agenda, and that's why she also put a lot of emphasis on putting preventive health in this mandate. And I think environment aspects and pollution aspects can play a very important role in preventing diseases in the first place. One of these work strands that our colleagues in DG Sante are working on is on cardiovascular diseases. So the plan is to come forward with an EU cardiovascular health plan by the end of the year. And so these interlinkages are multiple in many areas, but we can build on some successful collaboration because we have also been very closely collaborating on pollution and health in the context, for instance, of the Beating Cancer Action Plan that was also adopted under the last mandate. Last but not least, I wanted to mention that our president also announced a specific initiative on the global health crisis, because as pointed out by our host, quite rightly, pollution doesn't stop at borders. And so this is another area where I think we can positively contribute to the policy work. In addition to the cardiovascular strategy or the plan that I've already mentioned, a few areas that I wanted to bring to your attention that we are specifically working on. We've just finalized, and that was adopted in June, the European Water Resilience Initiative. A bit earlier, also the Vision for Agriculture and Food, very close link to the health dimension in both documents. And also for the chemicals industry, working on REACH here in our department. But we are not only working on REACH, but also on other initiatives such as persistent pollutants, such as PFAS, where we realize more and more that the legacy problem we have and the accumulation we find in biomonitoring and so on really poses a serious threat, and thereby we need to see what other policy measures we can take. First step, of course, is prevention and trying to restrict these substances. But those who are already out there in the environment will probably have to go one step further. We will continue working on reducing health inequalities. This was one of the flagships of the Zero Pollution Action Plan. This is particularly to point out that we also notice a lot the social dimension being important in this pollution and health link. If you can shed some more light on that particular aspect on inequalities, that I think is indeed very valuable. In order to do so, I think, and I just want to show that to you as an example, we are really promoting very much that it is key to bring environment and health data together. And Gerardo in the presentation afterwards will certainly say more about the work that they are doing with us together. But I wanted to show you something that the JRC is doing, and led by DG Sante, is to basically bring the cancer registry together with air quality data, and they have made a specific analysis and published a few policy briefs. And these type of things, this type of work is only possible if it's underpinned by good research. And I can see very many promising projects in your cluster where you can contribute to bringing data together. All of this evidence, and also at some point, hopefully your work, feeds into the Zero Pollution Monitoring and Outlook. We have just published the second Zero Pollution Monitoring and Outlook in March. It has a whole section on health and pollution. There's a number of research projects also mentioned. The results of these research projects are mentioned. And the idea is to update this work and the evidence base every 2 years. So the next one we are planning together with our colleagues from the European Environment Agency and the Joint Research Center, who are actually doing the work and actually publishing this report by the end of 2026 again. And then hopefully, if you already have results, or then in the next cycle, 2028, that would be really for us, we would be very keen to use that vehicle to bring that to a wider attention as well from a policy perspective. And last but not least, I want to mention the work that we're doing on chemicals. So there is a specific monitoring framework that feeds into the zero pollution work on chemicals. And there, of course, we are not only looking at the impacts of chemicals, but we're also looking at production and use, at alternatives, and really trying to maximize the benefits to society, and underpinning that by an indicator framework. So I think that is another area that that potentially will be very closely linked to your work. Out of that work, we have a number of research topics that is certainly not complete here on that list, but as a kind of overview, and that is also what feeds into then the design of the clusters that you're now launching. I think you will also recognize a number of these things for your work. I think one thing that I want to particularly highlight is that, of course, the combined effects of pollution. So whether it's a mixture of chemicals, or whether it's combining with other health factors, I think this becomes still challenging, but I think it's an important topic to further keep digging and further keep uncovering these relationships. So I finish with a few messages, hopefully that you find useful. What is happening on the policy side from our perspective is that we have set the overarching policy and legal framework. And our focus then turns now really into implementation and getting the ambition that we have set at the European level rolled out on the ground. I think one area that we believe can do that is by strengthening this nexus with One Health between pollution and health, and with focus on prevention, which is always difficult to prove if you prevent something, but I think it's the most effective way of going forward rather than just remedying something that has gone wrong. And a highlight that I would think is an important work that we will continue doing, and where we need your support, is bringing these different evidence bases, but also the data underpinning them together, and sharing them so we can use them for policy analysis. And that concludes my talk, and happy to answer any questions there may be, but I will have to leave soon. So I will leave you in the capable hands of my colleagues at some point, and I'm looking forward to hearing the results from your workshop, and I wish you good luck for all your projects. We are counting on you. Thank you, and greetings from Brussels.